kababayan, ang pambansang awit ng Pilipinas.
Kayang magiliw, ewas ng sinangalan, alam ng puso, sa dibdib mo'y buhay. Lupang hinirang, tuyag ka ng magiting, sa manlulupin, di ka pasisingil, kagagat ang putok sa simoy at sa langit ng pagaw, ay ginatang tulakaw, sa pagkayang minamahal. Ang patawad mo'y tagumpay na naghihingi, ang bituin at araw niya kailan pang ay di magtitingin. Luma ng araw ng walhagit pagsingka, mo'y langit sa piling mo. Ang hindi kaya na pagkay magami, ang mamatay ng dahil sa'yo.
Please be seated. To lead the satellite program of the Roundtable discussion in Asia, let us all welcome the immediate past president of the Philippine College of Physicians, Dr. Maricar Limpin.
Good morning to everyone. So, in behalf of the officers and board members of the Philippine College of Physicians, let me welcome each and every one of you who are joining us today in our roundtable discussion here at New World Hotel Makati. This is actually the second Asian RTD on vaccine effectiveness, as I've said, hosted locally by the Philippine College of Physicians. And this RTD is co-organized by our counterparts in the ASEAN region, by Chiang Mai University Faculty of Public Health and the Indonesian Society of Respirology. So later, we will actually be joined by our participants who are having their own satellite event in the different parts of Asia. We are also having a live streaming of this event on the PCP Facebook page. So this session will definitely include a lot of discussions on vaccines, so that includes effectiveness of COVID-19 vaccines in the midst of the Omicron virus, which is the predominant virus that we are seeing now in this pandemic, to be discussed by Dr. Anna Ong Lim. Then this will be followed by a discussion on the new data on the protection given by third and fourth doses, which I think is quite interesting to every one of us here, to be given by Dr. Suwat Charia Latersak. And then this is followed by a discussion on the safety profiles of vaccines. One topic that will probably be very important, and vital to be learned, by our fellow Filipino. This time to be discussed by Dr. Bruce Mungal, from Singapore, and then the importance of vaccine in the continued fight against the endemic COVID-19 will actually be presented by Dr. Christopher Lee. And then lastly, we will have our very own infectious disease expert and Vice President of the PCP, Dr. Ronchin Solante, who will give the synthesis of findings and its significance across governments in Asia as we continue to shape vaccination strategies to protect the people from emerging variants of COVID-19. Then we cannot, of course, not have the government side in these roundtable discussions, and thus we have the Department of Health who will also share with us their thoughts on all of the discussions that we will be having today. So definitely, we will hear what will be the upcoming activities of the DOH, aligned with the intensification of booster vaccination in the country. So that, ladies and gentlemen, we know that we have so much in store for everyone today in this venue Indeed, we are hoping that this will be a productive morning for each and every one of us. So with that, to formally open our event, may I call the President of the Philippine College of Physicians, Dr. Diana Alcantara Payawan.
Distinguished guests, colleagues in the medical profession, media partners, and stakeholders, good morning to everyone. It has been over 2 years since we battled COVID-19. We have come a long way from handling this public health crisis. Today, we have better approaches to the intermediate intervention and treatment, contact tracing, isolation, and more accurate testing. The actions taken to contain and mitigate the spread of this virus can be attributed to the agile scientists, epidemiologists, physicians, and industry partners who did not back down until the crisis could be addressed and dealt with swiftly. Last year, the world started COVID-19 vaccination after an unprecedented pace of development. Albeit, as emergency use authorization, the vaccines had massively and rapidly reduced infection and death across all populations. And according to the Department of Health, about 160 million doses had been administered in the country as of August 2022. While the general population's first and second doses were well received in the most regions, the booster doses uptake had a steep decline. The waning immunity in the new challenge becomes now an important concern. As a result, COVID boosters are likely moving toward an annual vaccination like the influenza that we have. It is becoming increasingly clear that looking forward to the COVID-19 pandemic, in the absence of a dramatically different variant, we likely are moving toward a path with a vaccination cadence similar to that of an annual influenza vaccine, with annual updated COVID-19 shots matched to the currently circulating strains for most of the population. COVID-19 vaccine remains our single most vital tool to protect people against the serious illness, hospitalization, and death. Data has shown that those vaccinated mounted a neutralizing antibody response that was at least comparable and in many respects better of what we use in the convalescent serum from individuals who recovered from COVID-19. Given the recent increases in death and hospitalization associated with BA.5 variant, everyone should stay up to date with the recommended COVID-19 vaccinations, including additional booster doses. The Philippine College of Physicians plan embarks on separate points. The first is to improve fundamental knowledge of the virus and make the public fully aware of the primary prevention standardized protocols, standard data, and safety monitoring boards. And secondly, of course, the effectiveness of vaccines and alleviating the general vaccine hesitancy. We at the Philippine College of Physicians moves towards normalization. We know the issue of waning immunity and the need to boost immunity through vaccination. The meager 2.4% vaccination booster of the priority group of the government needs to be addressed and needs to be addressed fast. This is the objective of our VAC-AP program of the Philippine College of Physicians, to spearhead this activity to create awareness and collaboration. This roundtable discussion on understanding COVID-19 vaccine effectiveness is a nidus for our VACA program. The webinar serves as an overview of the vaccine efficiency, statistics, and of course, best practices of our Southeast Asian neighbors. We hope that with sharing of ideas, we will be better equipped to address our challenges of administering COVID-19 vaccines, including booster doses to our populace, especially in the highly vulnerable. The college will also kick off a vaccine campaign nationwide through our local Philippine College of Physicians chapters, component societies in the coming days. With strategic information dissemination and targeted action plans, we hope to improve the vaccine confidence and adherence to public health protocols and ultimately achieve immunity and recovery from this prolonged pandemic. We will continuously work with the Department of Health in addressing this concern. I would like to thank our resource speakers for giving us their time and sharing their knowledge and experience with us. The challenge reminds us, physicians, of how vital our role is, and that as healthcare providers, we must inform and disseminate this information to the public. Thank you also to all of you who are joining us, our media partners. We are delighted with your participation and support, and we hope you will impart and share whatever information you pick up and give it and filter out to your family, to the friends, and to the rest of the community. Once again, from the Philippine College of Physicians, I wish you all good morning and have a wonderful day.
Thank you very much, Dr. Payawal. So we are going to start in a few minutes the main RTT, the Asian RTT, with our speakers from Thailand, Indonesia, Singapore, and of course, the Philippines. But before we dig deeper into the discussions, let me just give you a few reminders to those who might want to raise questions later on. We will have 2 sessions for the Q&A. The first Q&A shall happen within the Asian RTD. You may write your questions for the foreign speakers right after each discussion. Kindly hand your written questions to our PCP staff so that we can send them online to our Asia area. It will then be read together with the other questions from different countries. Then the second Q&A session will happen after the Asian RTD. You'll get the chance to ask our local speakers, Dr. Ana Ong Ling, Dr. Ronchin Solante, and of course our very own President, Dr. Diana Payawal, face-to-face. For our friends from the media, if you wish to have a one-on-one interview with any of the speakers, be it foreign or local, in line with the content of our RTD today, you may reach the PCP Secretariat or our friend here, Tina Marasigan. We shall now stand by for the Asian Area RTD, moderated by Dr. Juliana Chan, an Asian scientist. We hope that you'll be able to appreciate the new findings and the insights of our experts on the vaccines that we have right now to help us adapt to the new normal. So stand by, Asia RTD.
Good morning, everyone. Welcome to today's Media Roundtable on the effectiveness of booster vaccines. Good morning, everyone. Can you hear me, everyone? Shall I begin? Are we ready to go? Good morning. Well, I'm just going to start again. Welcome everyone to today's Media Roundtable on the effectiveness of booster vaccines against COVID-19, co-presented by the Chiang Mai University Faculty of Public Health, the Philippine College of Physicians, and the Indonesian Society of Respirology. I'd like to extend a very warm welcome to the journalists who have joined us from across Asia. I'm Juliana Chan, founder and CEO of Asian Scientist magazine, and I'm delighted to be your host for today. We are at a critical stage of the pandemic as key decision makers around the world consider how to live with the virus while ensuring populations remain protected. 5 infectious disease experts will present newly reviewed data from over 50 real-world studies on the effectiveness of COVID-19 vaccines as boosters when it comes to preventing serious outcomes and saving lives. In particular, our experts will also share their findings on how well boosting works against the Omicron variant, the need for ongoing booster programs, as well as whether vaccines specifically targeting new variants will be necessary in the future. Let me introduce our panelists for today. We have Dr. Anna Ong Lim from the University of the Philippines, who is also a member of the Technical Advisory Group, Department of Health, Philippines. Next, we have Dr. Christopher Lee from Taylor School of Medicine in Malaysia, and the former National Advisor for Infectious Diseases at the Ministry of Health, Malaysia. Next, we have Dr. Suwat Chariyatlutsak, Dean of the Faculty of Public Health at the Chiang Mai University in Thailand. And finally, we have Dr. Bruce Mungle, Asia Area Medical Director, Vaccines and Infectious Diseases, AstraZeneca. Closing remarks will be provided by Dr. Ront Jean Solante, Vice President of the Philippine College of Physicians, followed by a Q&A session of 10 minutes. All right, starting off today's Media Roundtable on a strong note is our expert panelist, Dr. Anna Ong Lim from the Philippines. Dr. Ong Lim, hello, good morning. How are you doing?
Hi, Juliana. Great to be with you.
Thank you for joining us here today. I understand that you and 21 leading experts set out to look at how effective the booster vaccinations are. Could you share with us how you went about such a review?
So thanks, Juliana, for that question. I think before we go on to answer that, it might be interesting to look a little bit at why this review was conducted in the first place. And this was really because of the need to actually better understand how well boosters work and how safe they are, based on data coming from real-world settings and looking at a broad range of vaccine platforms. So it was hoped that this information would be helpful for decision makers, especially in our part of the world and other lower middle income countries, where there's so many limitations on supply and access, and programs are actually innovating with different schedules that are maybe not established. So going on to your question, the review started off by consulting the online IVAC View Hub global database, which contains over 334 studies on vaccine effectiveness and efficacy. So I'll explain a little bit more about IVAC in a moment. So after looking through that database, there were studies, the relevant studies were picked out. We analyzed the data, visualized it, and then ran the statistical tests and consulted with 22 experts from all over Asia and Latin America to get their reaction to the data and their interpretation. Then this manuscript was co-authored, presenting the data and giving our perspective on what it means for vaccination strategy moving forward. So in the next slide, we see a little bit more information about ViewHub and IVAC. IVAC actually stands for the International Vaccine Access Center. They're part of the Hopkins Bloomberg School of Public Health, and their goal is actually to accelerate vaccine access through research and advocacy. So aligning that mission with the needs of the COVID pandemic, they set up this online database of studies on COVID-19, and they refer to this as VIEW Hub, where VIEW stands for Vaccine Information and Epidemiology Window. So the database allows the users to visualize real-time information on vaccine use, product type, coverage levels, impact assessments. And this is really very useful for people to have a better understanding of how these COVID vaccines perform. Now, because the IVAC team has very strict criteria about which studies make it into the database and which need to be excluded, then we can be quite sure that the data we were including in our analysis has gone through a really rigid vetting process. So in the next slide, we see that the 22 expert reviewers who were part of this team were actually belong to public health experts, group backgrounds, or infectious disease backgrounds, and many have actually been involved in advising on COVID-19 strategy in their home country. So I'm most familiar with the team coming from the Philippines, and just maybe to mention their background so we can understand the group a little better. Dr. Solante is actually part of the vaccine expert panel that advised our government on the science behind the newly introduced vaccines, while Dr. Lobo is actually part of our AEFI assessment team. So similar backgrounds across the other experts included in this expert review group, and they're really authorities in their countries and globally. In the next slide, we'll see where we focused in terms of the review. The analysis was really centered on looking at issues and outcomes that are relevant to the current situation. So I mentioned that there are 332 studies included in the database, and out of those studies, 52 fulfilled the parameters which the team felt would provide the most significant information. The studies looked at how booster doses were doing, and we only looked at the Omicron period, which started late last year, to the period of 2022 up to 2022. The focus was really on the more severe outcomes, and by this I mean that COVID infections that ended up with admissions to the hospital or the emergency department, or perhaps for those people who would end up on a ventilator or ended up unfortunately dying from COVID. So I hope I was able to give you an overview, Juliana, of how this was done.
Thank you very much, Dr. Ong Lim, for explaining the process. The focus of the research is certainly highly relevant for where we find ourselves just now in Asia. Now, before we explore the findings, could you please share with us precisely what vaccine effectiveness means and how do we measure this exactly? And perhaps what is the difference between efficacy and effectiveness?
So thanks for bringing that up, Juliana. We hear these words so often now, and I think we have this impression that they mean the same thing, but they're really different concepts. In research, when we talk about efficacy, it's an outcome that is measured in a clinical trial setting. Generally, this means that there are very tight controls applied on what processes happen and how the participants are selected. And so because the parameters are really very clearly defined, we can be quite certain that whatever outcomes are measured are due to the conditions that are applied in that setting. So efficacy data is critical as a basis for securing approval from regulators, because of course the view for regulators is focused on making sure that these formulations are safe and they work as they are claimed to be working. So we know that it is very critical for approvals to be obtained before these vaccines are used for the general public. Now, on the other hand, if you look at the right side of the screen, there's a diagram describing effectiveness, and this is basically what happens in the real world setting. So that's why we typically pair it with that phrase, real world effectiveness. This is determined outside of the settings of the clinical trial, which means you have a broader population, more heterogeneous, different qualities and features and characteristics. And they can reflect what's happening in the real world in the sense that maybe the schedules won't be followed as exactly as they would be in controlled settings. And there may be some variations in terms of intervals and schedulings. And although they seem to be providing less controlled data, their value is really more to monitor how these vaccines work in a realistic setting. So in the next slide, we see what real-world vaccine effectiveness actually means. We've heard people talk about vaccine effectiveness of 80% or 90% or 70%, and we seem to think that this is reflective of how well that vaccine is expected to work, when in fact this is referring to the percentage reduction of the expected outcome. So what does that mean? If you look at this diagram and you start off with 10 unvaccinated people falling seriously ill due to Omicron in the real world, giving them a vaccine that is claimed to have 80% vaccine effectiveness means that we reduce those 10 people to just 2. So it's an 80% reduction of the outcome, which is serious illness and ending up in the hospital. So I hope, Juliana, that was clear enough. It's a really difficult concept to explain, but I think this is a starting point for people to understand the data on the same plane.
Thank you. That is actually very clear, Dr. Onglin. So shall we just move on now to the results of the expert review? Would you please share with us some of the key takeaways on the effectiveness of current vaccines against Omicron?
Okay, thanks, Juliana, for allowing me to go through the data very quickly. It's a very, well, the paper itself has a lot of information, but we chose to highlight just 3 specific points. First, if everybody will focus their attention on the lower part of the screen, we state that all boosted COVID vaccines showed high effectiveness against Omicron-related severe disease and death in the elderly as well as in the general population. So what do we mean by this? I mentioned earlier that we included 52 studies, and out of these 52 studies, there were around 250 data points that were compiled with the first group looking at the impact of the vaccine on the general population and comparing that to elderly individuals over 60 years old. So we saw that regardless of the platform used for boosting, the effectiveness for these 2 groups was quite high if the outcome we were measuring was protection against severe disease and death. So this is actually quite reassuring, especially because, as I mentioned at the start, one of the limitations in lower middle income countries is really we have to work with what vaccines are available in our systems. And there might be a perception that some vaccines are better than others. And this kind of data is reassuring. The next slide shows us that all studies or all the studied homologous vaccine schedules are as effective as one another in protecting people against Omicron-related severe disease and death. Again, another very reassuring piece of information, because if you look at whether individuals receive an AZ primary and booster combination, or a mRNA combination of primary and boosters, or even if this was the inactivated platform CoronaVac, these homologous schedules, meaning all the 3 doses received were coming from the same brand, clustered around the same range of vaccine efficacy from a low of 75% to a high of over 90%. Finally, the last slide shows us a data set that's actually even more relevant for the Asian population, or in the Southeast Asian population, because many countries sorry, I got signed out for a bit. So let me go back to this last slide. So I was saying that this is actually very relevant to the Southeast Asian population because a lot of us received heterologous boosters. And so looking at these groups of participants in the studies, even those populations that used a mixed schedule, whether that was a mix of an mRNA and the viral vector platform, which is shown in the first 2 columns, or a mixed mRNA brand, or in the last, second to the last column, a inactivated primary with an mRNA booster. The efficacies clustered again within the same range, about mid-80s to a high of 98%. So I realize I'm using a lot of jargon in terms of the platforms, but I think our journalists are quite familiar already with the different types. And I hope if you have any clarifications later, we can go through this data much more closely. Thanks, Juliana.
Thank you, Dr. Ong Lim. Actually, it was very clear. Your communication was very clear, and thank you for explaining to us. It's also very reassuring because many people in the region have received a mix of different vaccines. I want to move on to another question that is certainly at the top of many government and health authorities' list of questions, but also very interesting to the rest of us. So how long do these vaccines protect us for? You know, I think many of my friends and family are now fully vaccinated and have also had booster shots, including myself. But it appears to me that many of them still catch COVID-19. How is this possible?
Well, that's certainly something that's on top of everybody's minds. And I have to say, even in my own circle, this is something that's happening. And leaves us a little worried about whether the protection we've received is durable. So what we are seeing now is that the effectiveness of these current vaccines in preventing infections and mild symptoms drops off pretty quickly in the first 3 months after booster vaccination. So if everybody focuses their attention on the darker circles, you'll see that initially you can expect vaccine effectiveness of about 67% immediately after the booster, but this drops off to as low as 30% 3 months down the road. But what's really reassuring is that for severe disease, which is actually the outcome that we were trying to prevent when these vaccines were being formulated, the level of protection is quite impressive in the way in that it persists for a long period of time. So it's retained 3 months and beyond. And some of the data contributing to the 77.5% number is collected more than 4 months after the third dose. So the reason why we don't have much data beyond that point is because studies going into the Omicron period have only really been running since the start of the year. And most of the studies that are included in the database have actually only followed the people for 3 months maximum. Juliana?
Thank you, Dr. Ong Lim. So that's really interesting. It turns out that the vaccines aren't stopping people from getting infected, but they're protecting against severe outcomes, and this protection lasts for at least 3 months and probably longer. Now, many countries around the world are already into their 4th doses, and many countries in Asia are considering the same. I understand that there were some early findings about how helpful the 4th dose really is. Could you tell us about what we know so far?
Well, there isn't a great deal of data on 4th dose effectiveness, but we did see an encouraging effect of protection coming from the 4th dose when you look at outcomes like severe disease. Now, the data was collected mainly in the elderly population because these are really the most vulnerable groups that were initially offered the 4th dose and they were prioritized. So the IVAC database at the moment doesn't really contain a lot of 4th dose data, but we actually have first-hand information coming from Dr. Suwat and his team, and they've been looking at 4th dose effectiveness, so maybe they're the best people to ask for this question and information.
Thank you very much, Dr. Ong Lim. It's really interesting insights into the importance of booster doses. Now, let's move on to Dr. Suwat from Chiang Mai University. Good morning, Dr. Suwat. How are you doing?
Very well.
Welcome to our Media Roundtable. So I understand that you have very recently published research that takes a very deep dive into the 4th dose effectiveness. Would you please share with us some of these details?
Okay. Yes. We have already conduct to study by looking for the big database that we have in the Chiang Mai, northern of the Thailand. The first preprint that come out, we focus more on how the vaccine, especially 3 dose and the 4 dose, or the first and second booster, can prevent infection. That I'm not going to talk today, but I'll focus on the second preprint. There will be the cohort that we look the vaccine, the 3rd dose and the 4th dose, to reduce the seriousness of the disease and also to prevent the death. So that will be something that I want to focus today. And we also try to looking to compare different vaccine that we use in Chiang Mai area. Either is viral vector as AstraZeneca or the mRNA vaccine, either the Pfizer or the Moderna vaccine. Next, please. So this is the data come from the Chiang Mai side. We did this study during the Omicron period, between the February until the April, around 3 months in the beginning of this year. And we look the vaccine that we use in Thailand. Mostly for the first 2 doses of the first primary vaccine, mostly will be maybe the CoronaVac or Sinovac, Sinopharm, and also for the AstraZeneca in the elderly people that we use in Thailand. Quite a few that go with the mRNA, either Pfizer or Moderna. That's the first 2 doses. And if we come with the 3rd dose and the 4th dose, you can see here in the slide for the 3rd dose, it's a big proportion of the mRNA vaccine, either Pfizer or Moderna. And also around 36% is AstraZeneca. And for the 4th dose, mostly will be the mRNA, but still we have the AstraZeneca around 70%. Next, please. So we did the analysis from the data that we have to looking how the vaccine of the 3 dose and the 4 dose can prevent the seriousness and also the death by the Omicron during the 3-month period of this year. And we look by the age group. From this slide, compare what Anna present previously, you can see for the 3 dose, it's nearly the same. It will work really quite well in the adult and also much better in the elderly people. So the 3 dose itself can prevent a lot of the serious outcome and prevent the death as well. That will be really, really important for the people and also for the public health facility, because you can prevent the people from the seriousness, and then most of them, if they are very mild, they can taking care at their home and keep the hospital bed only for the moderate or the severe people who really need the ICU or need the ventilator. But interestingly, if you look at the 4 dose, during the Omicron period, February until the April of this year, in Chiang Mai area, we have around 175 people who have a serious outcome or death, from around 300 1,000 cases of the COVID in Chiang Mai alone. And you can see all the dead people, all the serious cases. The people who got the 4 doses, we don't see any one outcome happen in the people who get the 4 doses. But mostly around 80% will be happen in the people who don't any vaccine before. So that's very important message for us. Next slide, please. And then we try to look for the compare by the vaccine that we use for the booster dose at the 3 doses that I mentioned before. The 3 doses that we boosted in Thailand, it can be the AstraZeneca or the Pfizer or the Moderna. And we compare how there is reduction by the vaccine type as a booster. And you can see the slide, it's nearly the same, nearly around 89 to 90% with any booster that we are used on the primary vaccine that we use in Thailand. And the same as I mentioned, we don't see any case who have the 4 doses and then have the serious outcome put on the ventilator or even dead as well. Next slide, please.
Dr. Suat, this is remarkable data, and clearly the currently available vaccines are providing important protection against severe Omicron-related outcomes. So what does this mean in reality when we think about boosting? Do you think that regular boosters will be required for everyone?
Yeah, if we look in the data that we have, I think what it really show us from the data that we did in the Chiang Mai area, and also the data here is also the same as any data published from the Western country as well. So right now, I would like to say that to prevent the infection, for the 4 doses, it may be dropped. That I don't present here is drop around 70% to 70%. But to prevent the severity and prevent the death, for the 4 doses, up to now it's nearly 100%. You may have feel, but it's very, very rare to have people who have the 4 doses. And maybe the people who have the 4 doses, maybe they're very ill or they're very old as well, and then they may have any comorbid. But for the 3 doses, it really worked very well. The data that we saw in the paper that we have it here, we saw that the highest protection for the serious outcome is between 14 days to 3 months after you give the booster shot. And then after the 3 months to 6 months, it may be dropped a little bit, but it's still around 87%. It should be very, very high. And then some people keep asking me, how about after 6 months? The data right now in Chiang Mai is not come to that point, but we are looking for the data around the mid of the year, maybe between May to July, that we are working on. But I still believe that even if past the 6 months, the effectiveness to prevent the severity may be dropped a little bit, but still quite good in terms of the protecting of the seriousness and the death as well. So the key message right now, I think the coverage of the booster dose for the 3 doses will be what we like to emphasize now in the country. And then either you can use the homologous vaccine, that mostly the paper from the Western country that they use the mRNA vaccine, but the country in this region mostly it will be as a mix. You can use the inactivated vaccine and then you booster with the viral vector vaccine, or you use the viral vaccine and then you boost with the mRNA. That will be really show the same effectiveness in terms of the prevent the severity of the disease and prevent the death. So that's why the key message right now for the country, how we are going to convince the people, especially the people who are elderly, above 60 or 50 years old, and then the people, those who have a lot of the comorbid. It will be really, really important for them to get a booster shot, either 3 doses and 4 doses, to help them to prevent the seriousness of the outcome, and then it can help to keep the facility of the hospital to taking care the other illness as well. Yeah, that's my point.
Thank you so much, Dr. Suat. Thank you very much. So it seems very simple to me. Additional doses at the right time will be necessary to protect us against severe disease or worse. All right, I'm going to change gears a little here. With additional doses being required, lots of people are still concerned with vaccine safety. And so at this point, I'm going to bring in our third panelist, Dr. Bruce Mungle from AstraZeneca. Turning to you, Dr. Mangal, what do we know about the safety of these vaccines that perhaps we did not know a year or two ago?
Thanks, Juliana. Safety is a very important part of this vaccine discussion, obviously. So firstly, I think it's important to recognize that everything we do in life has some risk associated with it. A SARS-CoV-2 infection that leads to COVID-19 disease can have very serious and potentially life-threatening complications, particularly if you're not vaccinated. So once people get infected with the virus, there's no way to know how COVID-19 will actually affect that individual. Anyone can get sick and potentially become very seriously ill. And we know that older adults and those with underlying medical conditions, such as people with high blood pressure, heart and lung problems, etc., these are all at higher risk of developing serious illness from COVID-19. And we know that this severe illness from COVID-19 can result in hospitalization, potentially ICU admission or even death. But importantly, the vaccines we have are all very highly effective at preventing these particularly nasty outcomes. Now, on the side of that, vaccinations themselves are also, potentially associated with some very common side effects. Quite often people have some pain and swelling at the injection site. They might have, some mild fever, etc. Importantly, these are all, usually very short-lived, and the vast majority of people recover very, very well. And sometimes, even more rare occasions, there are some other more serious adverse events that may happen. Allergic reactions do happen with certain vaccines as well. And we've seen a few inflammatory reactions such as myocarditis, etc., that happen as well. A key thing to remember about these more serious events, though, is they're often very, very rare. So if we just go to the next slide, I'll talk through a little bit of that just so you've got a bit of perspective on that. So some of these events with these COVID-19 vaccines have been designated as adverse events of special interest, AESIs. As I mentioned, these are often quite rare, but they can be a bit more serious than expected with normal vaccination events. So a few of these are actually being watched, quite closely, and that's for very good reason. We need to make absolutely sure that we know what's happening in terms of vaccine safety. And importantly, now that these vaccines have been rolled out globally and, literally billions of doses of vaccines have been used so far, there's an enormous amount of data accumulating on their safety. So if we go to the next slide, I'll just talk you through a few of those studies are available. This is not a fully comprehensive list, but I just wanted to provide a bit of a snapshot here, and particularly to emphasize the scale of some of these studies. Now, there's one study here, the one on the far left from the UK, that just looks at the common adverse events, but particularly after booster doses. You only need a few thousand people. These are relatively common events in terms of pain and inflammation, etc. So you only need a few thousand people. So the study looked at that very well. And they looked at a range of different booster doses in the UK, so 7 different vaccines. And they demonstrated from this study that they're all very well tolerated, and the rate of these common adverse events is actually quite low, potentially even lower than up to see with the first or second dose. So that's kind of key point number one, that the booster doses are quite well tolerated by the vast majority of the population. All the other studies here were focused on finding these more rare but potentially more serious events. And to do that, obviously they need to evaluate millions of people. That's how rare most of these events are. So if we go to the next slide, I'll just provide a quick overview of what we're seeing from those particular studies. And as you can see from here, what we've got is basically circles which illustrate the rate of these events compared to background rates in those that are unvaccinated or uninfected with the virus. And the size of the dot demonstrates the increase in the rate over the background. The thing that you'll see, I think, for very quickly for most of these vaccines is the rate is relatively small and relatively similar across all the different vaccines. For most of the dots that you're looking at here, the rate is only about 2 to 3 times above background rates, which are inherently very low for many of these events. The other thing that becomes very obvious, if you look towards the lower portion of the slide here, is that many of these events also occur in cases of COVID-19. And in most cases, the rates due to a virus infection are actually much, much higher than you see with any of these vaccines. And now, because the vaccines are actually very good at preventing these serious COVID outcomes, they also play a role in preventing many of these weird adverse events that we start to see. So if we go to the next slide, just as a kind of a high-level summary of that, what we've really learned from looking at these studies is that the risks of these potentially more serious events is actually very, very small, and oftentimes is lower with the second dose compared to the first. And what we're starting to see now as the data comes through is they're just as low with the third dose, and certainly with the fourth dose as well. So no additional cumulative risks that we're seeing so far. But importantly, what becomes very obvious is the health risks associated with getting infected with the virus and then potentially developing COVID-19 are much, much worse. As you've just seen, the rate for many of these specific adverse events, the risk is far greater in someone with COVID-19 than from vaccination. So if we can prevent COVID from even happening through this vaccination, we can further prevent the risks of many of these events happening at all. So if we just go to the next slide, please. I just want to kind of put that in context in terms of bigger picture. Normally when you roll out vaccines, you're talking about rolling out thousands or potentially even millions of doses. With COVID, this has been, the largest global vaccination campaign that we've seen. We've so far over 12 billion doses administered globally. I'm very proud to say that AstraZeneca has been responsible for more than 3 billion of those, so a very, very good contribution, I think, in terms of public health. But with this many doses being used, the amount of safety data that's been accumulated is overwhelmingly showing that all these vaccines have very, very good safety profiles. And then just to kind of, as a final talking point, I think, just to put it in perspective, we'll go to the next slide. The real reason we vaccinate in the first place is to prevent COVID and to save lives. There's a recent study that's estimated that almost 20 million lives have been saved up until the end of 2021. I'm sure that number will be much larger if we look at 2022 as well. But almost 20 million lives saved through vaccination up till the end of 2021. So the value of vaccination, I think, is very, very clear. Significant benefits in terms of preventing death and serious COVID outcomes, but importantly, with very favorable safety profiles. Back to you, Juliana.
Thank you, Dr. Mangal. There's clearly now a very large body of safety data showing the positive risk-benefit balance of these vaccines. So perhaps now I will turn to Dr. Christopher Lee from Taylor School of Medicine in Malaysia. Dr. Lee, good morning.
Good morning.
Thanks for joining us this morning. So maybe you could share with us what the key findings are from what you have seen from these data that will be most relevant to governments, healthcare professionals, and of course, the general public in Asia as they make decisions about how to move forward with these vaccinations.
Thank you, Juliana. After listening to our three experts just now, and it's clear that there are some very important messages. There's a lot of data over the last 2 years since we have handled this pandemic. Now, you can basically, in my mind, there are about 4 main takeaway messages, which I like to go through very quickly with you. Now, number one, I think that which is the most striking, that these vaccines work, and they work very well. Yes, we heard that as the vaccines go on, it may not be as effective in preventing an infection. But what is very heartening is to look at the data with regards to severe disease and deaths. And that has been really remarkable. The data that was shared, the number that was shared by Bruce just now, the number of lives saved worldwide, it's staggering. I think that is the main key takeaway message for us, that vaccines do work. Now, having said that, in the last 2.5 years with this pandemic, they have been very familiar with variants, and one variant led to another, and et cetera, et cetera. We are all learning our Greek alphabets all over again because of this. And these variants probably won't stop with Omicron. There will be more to come in the future. Now, with this new variants coming through, how does that impact on the effectiveness of our vaccines? What is certainly very encouraging is the vaccine seems to still work very well in preventing severe disease, even with Omicron. So it's important to remind ourselves now, as some countries have already got this variant-specific vaccines, especially some countries in the West. But for most of us in this part of the world, our turn to get this variant-specific vaccines may take quite a bit of time. So I think the data that we have so far, as we look at, if we deep dive into this, all these studies that we are seeing with linked to Omicron, it is important not to delay our vaccination schedules. Let's not wait for this variant-specific vaccines, which may take a long time to come, but use what we have first. So the effectiveness of the vaccines for the current Omicron strains still work well. The second point I would like to highlight is that we all know that boosting has become a main part of the vaccine program for COVID-19. Now, we know that in the history in this part of the world, and as we've seen in Thailand's data just now, that many of us in this part of the world may have had a mixed booster schedule, meaning one vaccine and a second dose with another vaccine, because of pragmatic and logistic reasons in most countries. Whether you have a mixed booster regime or have a homologous booster schedule, which is the same vaccine through and through, it shows that boosting with either a viral vector or an mRNA COVID-19 vaccine works very well, even with Omicron. And that has been shown with other variants before, but the data that we have seen with this review, that with Omicron, when we use an mRNA or viral vector booster, it works well. So this is where our data that we have up to now, this is where we can move forward, all right? Get the boosters, which will prevent severe disease, regardless of whatever you have had in the past. The third point I would like to stress is that subsequent boosters. I think in most countries in this part of the world, third boosters have been rolled out. And now in some countries, including mine in Malaysia, we have already been using the fourth booster. And we are prioritizing the older population and those with comorbidities for these fourth boosters. I think the data from Thailand was very robust to show that even after the third dose, the first booster or the third dose, all right, the vaccine still seems to work very well. However, the immunity seems to drop in preventing picking up an infection. But the effectiveness of preventing severe disease still seems to be holding. However, as the experience in Thailand has shown, but by 6 months or so, we are concerned that the immunity may not be strong enough. And a fourth shot or second booster is something that is on the cards. So in many countries, including mine in Malaysia, those who are older than 60 and those with comorbidities are being offered a fourth shot or second booster. Now that is important. Whether how long will this fourth booster last, how durable will it be, or as Suwan mentioned just now, time will tell. We are still fairly early in this period of time with regards to the fourth shot. Lastly, which is also extremely important, the topic that Bruce brought up just now with regards to safety. So whenever we have looked at the data and we know that these vaccines work. The flip side of the coin is always safety. How safe is it for the person that we are giving the vaccine to? I am very comfortable to say that the data that we have seen is extremely resounding, that the safety of these vaccines, all right, especially the boosters, has been extremely good. I mean, look at the number of doses being given out around the world, and the number of serious side effects that have been picked up has been so small. So balancing against the risk of severe COVID disease, and we all still remember how nasty COVID-19 can be, when we balance that with the safety profile of these COVID vaccines that we have now, I think it's a no-brainer. It's clear that moving forward with these vaccines are important. And as Bruce just now highlighted as well, the safety profile of those taking the third shot and likely the fourth shot seems to be even safer, or there are less side effects compared to the other shots. So that should actually give us confidence going forward to follow through with our required booster regimens. So Juliana, I believe these are the four main messages that we hope the authorities, the governments, and the people who hold the purse strings in the country should focus on going forward in the pandemic.
Thank you very much, Dr. Lee. That was a very helpful summary of 4 key takeaways, ranging from mixed booster schedules all the way to vaccine safety. So just before we dive into our Q&A, I'd like to invite Dr. Ron Jean Sante from Philippine College of Physicians, one of our hosts for today's session, to share a few thoughts of his own. Dr. Solante, please.
Yes, thank you, Juliana. So I'd like to show my slide first. So what has been reviewed this morning are important data which will help inform vaccination strategies as the government will make important decisions about the next step in the fight against COVID-19. And it's the best way to safeguard the population. In this review, this also reinforces the importance of booster vaccination, particularly on the waning effectiveness, especially with this highly infectious Omicron variant, that this vaccine still work and protect us against the more severe form of the infection, protecting the vulnerable population against hospitalization and death. And second is that we've heard a lot of discussions about variant-specific booster. But I think because of this data, current vaccines are still effective in protecting the vulnerable population. Instead of focusing our resources on getting these variant-specific booster vaccines, I think it's important that at this point, all countries should focus on how to increase vaccination coverage, how to increase uptake of booster vaccination in the population. Next slide. If you look at this data from One World, you'll notice that cases are going down, which I think vaccine has helped this matter a lot. And also the cases or the deaths are also declining, except in some countries where deaths are quite still high, but not as what we have experienced with the Delta. So I think this is still responsible because of the boosted population. But we need to continue involving and emphasizing the importance of booster, because when we talk of severity, the vulnerable population are the ones involved here in terms of higher death and higher mortality. Next slide. So here the focus in this region is really to make use of the current vaccine and improve the vaccination coverage. Next slide. And I think the last part and very important part of this review was on the safety data. And when we talk about safety data, when you look at vaccines, it's working and it's also safe, then it will also boost public confidence. And at the same time, it can also help in terms of the success of these vaccination strategies. So before I'll end my synthesis, I would like to take this opportunity to thank everyone involved in today's webinar for presenting this important and crucial data, and to continue collectively working to keep people safe as COVID-19 evolve. Thank you, Juliana.
Thank you, Dr. Salante, for that wonderful summary. And with that, it brings today's presentation to a close. I'd like to thank all our speakers today. Moving on to our Q&A section, we would like to invite questions from our audience. Please use the chat box function to ask your question, and we will do our best to facilitate as many of these as possible. I think we have 12 minutes to go. Let me take a look if any have come up. Okay, we've had a first question come up for Dr. Suwat from Chiang Mai University in Thailand. Dr. Suwat, could you please share with us, for younger individuals, and this refers to individuals under 40, would you still recommend that they get a fourth dose? This is from a medical doctor.
For the people who have a lot of the comorbid. For the younger people, if you are young but you still have any comorbid, I think that will be the target of the people who I would like to suggest you to get the second booster at this time as well. But it's not really like the Thailand now. We give the fourth shot or the second booster for the adult who really want to. So even if you are above 80 years old, you can get to the vaccine center and get a shot. But as I mentioned before, we try to convince the people now to get the third shot, and also the fourth shot will be the people who really want to. You can come, but we really emphasize more on the elderly people and comorbid people. That will be the priority that we like them to come. But if you are younger, 40, and then you want to get the second booster, the fourth shot, that should be okay for you, because it's really help you to prevent the serious outcome, and also maybe help for the infection, but maybe not very high during this period of the time. That will be my answer.
Thank you, Dr. Suat. That's a very good response. And then, of course, there's another follow-up question. It's related, and I'll pass this perhaps to Dr. Sulanti, please. Would you recommend annual or biannual shots after the third booster?
Well, at this point, it's very difficult to answer that, no? Because there are factors to consider when we will be moving forward and recommending an annual or biannual booster. And one of that is the cases, which means if there are still COVID virus in the next months or next year, we don't know if it's still an Omicron subvariant. If it's still an Omicron subvariant, then we would be focusing on a variant specific as an annual booster. If there are new variants emerging, then it will now depend on what vaccine we will be giving. And I think if we're giving the annual booster, it will be more focused on the vulnerable population, because the more important objective now is protecting this vulnerable population in developing a severe infection.
Thank you very much, Dr. Sulanti. I've seen another question come up, and this is directed at Dr. Ong Lim. Dr. Ong Lim, are the results between and within the effectiveness of the heterologous and homologous vaccine schedules significant? Is a mixed booster dose or a homologous booster schedule similar, or are the differences significant?
Yes, that's a really interesting question to discuss. I think, can you hear me?
I can hear you better now. It was a little bit soft before.
I think the data coming from the IVAC database shows us that the differences between the homologous and heterologous schedules are quite minimal at the current time when we look at least the data for the third boosters. So this is quite reassuring, because as I mentioned, much of Asia has really received these heterologous boosters. And there must be an impression that they are performing subpar, but so far we've seen that they're comparable.
Thank you very much, Dr. Ong Lim. Dr. Mango, would you like to add on to Dr. Ong Lim's response on the effectiveness of heterologous and homologous vaccine schedules?
Yeah, thanks, Juliana. I mean, it's a quite a complex data set we've got here. I think there's a lot of studies that have looked at this. I know, there was only 2 studies contributing to some of those higher vaccine effectiveness for 1 or 2 of the schedules. So it's very difficult to read too many conclusions into something that has 2 data points that support it. But for all the schedules that had, many, many more data points to support them, it did look very, very consistent. So I think we can be quite comfortable that regardless of which schedule you're using, whether it's 3 doses of the same vaccine or different vaccines, you're going to see very similar effectiveness, particularly against these severe outcomes, which is the important bit we need to be trying to prevent.
All right. Thank you, Dr. Mango. I have a few questions coming up here as well. Another question, maybe Dr. Christopher Lee could respond, because it's about Malaysia. Could you tell us, Dr. Lee, how this information is relevant to Malaysia's national boosting program?
Right. Thank you. Well, as in other countries, the third booster has been rolled out, and our uptake in Malaysia has been generally quite good for the third shot or the first booster. Now, when it comes to the second shot, just like what Thailand has done, we are recommending that to prioritize those of most vulnerable. However, as mentioned by our Ministry of Health and our Minister of Health in particular, he has mentioned that the uptake has been relatively low, not as good as the first booster. I think this issue of vaccination fatigue may also set in, or pandemic fatigue. So the uptake is generally low. Now, plus some people are also more concerned about the issue of safety. So I'm glad that this review that we have done does look at the overall safety over repeated doses. And I think Bruce mentioned that just now, at the safety profile of the third dose and likely the fourth dose will be probably as good or probably even better than the earlier shots. I think that should also be important. So to address this issue about people's hesitancy about going for subsequent shots, I think it's important for us to continue to educate them and to make them understand what happens to the vaccination after the vaccine has been given. The other thing I think we have to, hopefully in the months and the time ahead, as we get more robust data into the fourth dose, we can actually come up with a more regimented regimen. I'm sure in many countries, and Malaysia, of course, is one of them, people have complained that, oh, I've had my third shot, now I get my fourth shot, when do I need my fifth shot? No, that kind of questions will come up. But very likely, and I think this was alluded to just now, hopefully with more data in the future, we can come up with something more regimented. Perhaps something like influenza, whether that's a yearly or twice yearly vaccination for those who are most vulnerable. I think we are probably moving in that direction, but unfortunately we don't have the data now, and time will tell. So let's watch the data coming from Chiang Mai. That's important.
Thank you very much, Dr. Lee. And then on the topic of annual boosters, I've got a question for Dr. Solante about the Philippines. So the question goes, in the United States, there is a plan to make COVID boosters yearly, annual boosters. Do you see the same direction being taken in Asia and in the Philippines specifically?
Yeah, I think I've answered this one a while ago, no? But again, it will depend on the cases that we will be having in the next few months, and also the variant of concern that will be emerging during the time. Well, likelihood, I think there will be an annual booster, but we don't know the schedule yet, and most likely it will be still the target population will be the vulnerable groups.
We can take probably one or two more questions, and this is for Dr. Mango. As a Malaysian journalist, could you share what study in Malaysia was it that it was included in the earlier slide?
Yeah, thank you for the question. So a lot of these safety studies, the big safety studies that we're seeing, because of the potentially better surveillance, are often from Europe or the US. But importantly, there's actually been a really, really nice large safety study conducted from Malaysia very recently. This was a Ministry of Health study. They looked at national cohorts, so over 20 million people included into that study. And they looked at the rate of these adverse events, particularly these more rare ones, across all of the vaccines that they were using in Malaysia. And it reinforced results very, very similarly. They're getting quite similar rates of these events, safety events, with all the different vaccines, and they're quite comfortable with what they're using. So really nice data set, I think, that demonstrates that we can produce this kind of data from Asia as well.
Thank you very much, Dr. Mango. Let me see if there's any interesting question coming along. I have another question that is a little bit interesting. Dr. Solante, this is perhaps for you. Given that COVID-19 is continuing to rapidly evolve, wouldn't the development of variant vaccines be a more effective way to protect people from the most dominant strain?
Yes, that's very important, because when you have a variant-specific booster, then that will really produce antibodies specific for that variant. But we have to also to balance that in terms of resources, or is it really readily available in resource-limited setting like Asian countries or the Philippines. So with that should be part of the government plan to really acquire such a booster vaccine that is variant-specific. But as of this moment, I think the importance is to really emphasize booster vaccination of the population with current vaccine platform.
Thank you very much, Dr. Solante. And with that, we have come to the end of today's Media Roundtable. We've run out of time. If any of you would like to request to interview our speakers, please indicate your request in the chat function, leaving your details so that we can respond. A press release summarizing the findings of the research has also been sent to you via email for those who have registered with us today. And I'd like to once again thank everyone who has joined us this morning for an important discussion on the effectiveness of COVID-19 vaccines as boosters when it comes to preventing serious outcomes and saving lives. So my name is Juliana Chan. Thank you for joining us today, and I wish you a pleasant afternoon. wherever you are. Thank you very much.
Okay, so that was a very good discussions that we had this morning. So let me just share with you some of my thoughts on these roundtable discussions. Number one, really the current vaccines that we have now available with us, as you have seen in the data that was presented to us by Dr. Ana Ong Lim, are highly effective. So it doesn't matter, whatever vaccines you got during your primary vaccines, then you are rest assured that you were actually protected. Number two, whether you had homologous or heterologous vaccination, they are both comparable. Although, of course, there's a little slight difference wherein the protection rate given by the heterologous seems to be a little bit better. But again, the difference isn't really that great. And therefore, if you had, like let us say you had Astra for your boosters, then rest assured you were given enough protection, particularly for severe infections. Or Sinovac, no? So, or if you have a mixed schedule, okay? Number three, I think the most important, that I would like to emphasize, that the most important information I got from this discussion today is the safety profile. Diyan ho tayo tinitira ng mga anti-vaxxers. The safety profile. And it has been shown, you look at the data, the safety profile is really quite good. And the benefits from the vaccines that we have far outweighs the risk. So yun ho ang pinaka-importante, that all the time, as a clinician, this is the first dictum that we always have to take, and that the benefit must outweigh the risk. And for this vaccination, definitely the benefit far outweighs the risk that we can get from COVID-19. And as you can see, in the data, 12.5 billion doses already administered, and 19.8 million estimated lives saved. So I think I need to emphasize that. And lastly, all the data has actually shown consistent effectiveness of the vaccine, including the Omicron variant. So this actually suggests that there probably is really no need not to wait for the development of variant-specific vaccines. Although sabi nga ni Dr. Jean Solante, having the variant-specific vaccines, like let us say for specific, like for Omicron specifically, then syempre mas mataas yung magiging expected protection against that particular variant. Pero pag dumating na naman ng another variant, then what I am just saying here is that we need not worry about, getting variant-specific vaccines, because the current vaccines that we have right now is still quite effective. So with that, to further strengthen our discussion, particularly in this fight against the pandemic, of course, we have with us a representative from the Department of Health, and we know how tirelessly the DOH have really given, how tirelessly their efforts are as far as their desire to see the majority of the Filipinos to get boosted, no? So it will actually be good to hear from the department's plans in the pipeline and their call to action so that more people, particularly the ones in the medical field, as well as the private sector, including media and local governments, how we can get everyone involved. So let's hear the thoughts from the Department of Health, straight from Dr. Imran Rodriguez.
So, to all our medical professionals from the Philippine College of Physicians, to all our distinguished speakers in our roundtable discussion earlier, and all the representatives from the different organizations, a pleasant afternoon to everyone. I'm Dr. Imran Rodriguez from the Department of Health. So we've heard earlier po, how important it is to understand how our vaccines work, particularly why it is important to have our booster doses, regardless whether it's heterologous or homologous, to help us protect our communities. Also, we heard earlier how we discussed the risks and benefits of getting vaccinated. We've had additional information on the possible adverse effects as well. And I think that the biggest challenge that we are going to face in the next coming months is how we educate the Filipino people, how we get the message across that getting vaccinated is safe and that it protects them amidst all their misconceptions. So I think that at the heart of these discussions, we can all agree that vaccinating our communities is really one of the most crucial public health intervention that any country could have to put an end to this pandemic. So now in this discussion, we at the Department of Health would like to share the efforts that we are currently conducting in the country and how we can all align and to increase our vaccine coverage and help us fight this pandemic. So to start, let me just give a brief background on our COVID-19 situation. So as of September 7, 2022, the Philippines has reported a total of 3.8 million cases, of which 97.82% have recovered. Recorded deaths have remained relatively low, yielding 1.6% CFR, or known as the case fatality rate. And to date, we have surpassed 4 surges of COVID cases in total. The first one being the surge caused by the original strain on August 2020. So our highest recorded 7-day moving average was during the Omicron surge last January 2022 with around 35,000 cases per day. So as we can see in the recent weeks, we have seen a decline in the number of cases nationally. So with the current 7-day moving average of 2,372 cases per day, being 1% lower than what was reported the week prior. Additionally, there are currently 88 provinces, highly urbanized cities, and independent component cities, and 180 other component cities and municipalities have been de-escalated to Alert Level 1, while 33 other provinces, HUCs, and ICCs remain under Alert Level 2. So now, in order to provide greater protection to our communities and further drive down our number of cases, our vaccination efforts in the country continues. So as of September 5, we have already fully vaccinated 72.6 million Filipinos. So that is equivalent to 93.01% of our target population. Furthermore, around 18.2 million individuals had already received their booster doses. So this amounts to 23.4% of our target population. So these accomplishments would not be possible without the help of our different sectors in healthcare. And we would like to also extend our gratitude to everyone, to all our healthcare professionals, for your efforts in helping protect our communities. So our efforts in fortifying our wall of immunity should continue, especially if we envision to provide a safer and healthier living conditions to our communities. And in order to do this, we have to give immense importance in protecting our vulnerable population, such as the senior citizens, and boosting the waning immunity. So as such, the Pinas Lakas campaign was launched last July 26, 2022 by the Department of Health. So the President back then instructed the DOH and all implementing units, both public and private, to operationalize and implement the said COVID-19 vaccination strategies. So with the specific goal of achieving 90% primary series in the A2 population and also 50% coverage in the first booster doses for general eligible population. So these targets, as seen in the screen, were presented to the Office of the President last July 6, and the Department of Health computed a total of 1.07 million remaining target for the primary series among A2 population. While for the booster doses, we have a remaining target of 23.8 million among the general population. So for this campaign, we have been targeting to vaccinate around 17,000 senior citizens for primary series, while 397,000 for the general population for boosters per day. So where are we currently faring? So this slide shows the weekly trend for A2 population for the first 100 days accomplishment. So as of September 5, a total of 26,290, so that is equivalent to 2.48% senior citizens who have already completed their primary series. So, but we still have 1.047 million individuals to complete the last dose of primary series in the A2 population to reach our target. A2 vaccination proved to be very challenging as efforts have been stretched in looking for the unvaccinated seniors first and giving them their first dose of their primary series before having them eligible for their second dose of primary series to achieve our 90%. So while we had increasing jab rates as we progressed in the weeks 2 and 3 of the campaign, our accomplishments started to decline during the fourth and fifth week. So while we have relatively regained the increase in our week 6 accomplishment, we are hoping that such will be the momentum to further increase our coverage. So we would also want to commend regions 2, CAR, and NCR for reaching the 90% A2 coverage prior to the start of the Pinas Lakas campaign, and for continuously looking for our senior citizens to get vaccinated and further increase their coverage. So this can also be seen on the stack bar chart on your right side. So the dotted line shows our Pinas Lakas target, and the mentioned regions earlier have already reached our Pinas Lakas targets. So for our booster accomplishments, we can see that our trend for weekly accomplishments also shows an increasing trend for the first 3 weeks of our campaign. However, as we entered our 4th and 5th week, we noticed a decrease in coverage. And as of the week 6, our trend relatively increased, and we are hoping that this trend also will continue in the next weeks as we end our campaign. So the stack bar graph on the left shows that our regional coverage for booster doses are still far from our targets, with NCR as the only region almost reaching the targeted 50%. So given that our daily jabs among the priority group A2 and the eligible population for booster have not been met since the start of the campaign, this resulted in a higher weekly target for the remaining weeks of the first 100 days. In order to regain our momentum of the COVID-19 vaccination program, a week-long vaccination drive is needed, which will simultaneously be conducted nationwide to catch up with the increasing targets per week and to ensure the judicious use of available COVID-19 vaccines in the country. And so as such, we will be conducting the Bakunahang Bayan or the Pinas Lakas Special Vaccination Days from September 26 to September 30. So this vaccination drive aims to facilitate the rapid mobilization of vaccination services among all eligible population. So prioritizing our senior citizen for completion of their primary series and all our eligible population for their first booster vaccination. So now that we have around 2 weeks to prepare for our Bakunahang Bayan And also, that's equivalent to around 30 days na lang po, no, remaining for the end of the Pinas Lakas campaign. So in line with this, we would also want to request our experts from the different medical societies and professional organizations to join our vaccination drive. So your mere presence as COVID-19 vaccine ambassadors can really help us convince more people to get vaccinated. We are also requesting for you to help us in advocating vaccination among the eligible population, especially among your respective members. So sana po lahat po sila ay fully vaccinated din and boosted din po. So in line with the current strategies of the COVID-19 vaccination program, we would like to gather support in terms of conducting vaccination in our clinics, the workspaces, and other strategic locations. So issuance of position papers and release statements regarding the safety and effectiveness of COVID-19 would also be crucial, especially if coming from our medical societies and professional organizations. So if it would be possible to have also an issuance of memorandum of support to the presidential directives on the COVID-19 vaccination for the first 100 days. And also, as experts in your respective fields, we seek your support in communicating the safety and effectiveness of our COVID-19 vaccines under stability studies. So, and debunk the misconception on shelf life extension. So we have been having reports that some individuals and healthcare workers are still hesitant po to get vaccinated with vaccines that had their shelf lives extended. So even if these vaccines underwent a stringent study. So we need your help to address and give important information to correct these misconceptions, and that would be very crucial in increasing our coverage in the country. So more recently, the department also released an advisory for our lay people to explain the extension of shelf life through stability studies. So we also released an advisory to healthcare workers indicating the updated shelf life extension of certain batches of vaccines. So the labels on the vaccines cannot be tampered, hence the need to explain to our healthcare workers, the general population, that vaccines have extended shelf life even if the label has a due expiry date. So more importantly, we look into you to help us educate the people regarding the need for booster doses, especially those who are already complacent having their having completed their primary series. So this have been a very big challenge for us in order to keep our coverages high. So we've seen your presentations earlier regarding the VAC up, and all these efforts are also very much appreciated in increasing our booster coverages. So we've learned earlier in our discussions that the importance of our boosters, that although it doesn't really protect us fully from getting infected, it gives us protection from getting the severe disease and death. So although that we are having the national vaccination days within the Pinas Lakas campaign, we would like to highlight that our vaccination efforts will still continue beyond the vaccination days. So how else can we collaborate? So our Pinas Lakas campaign educational and motivational materials are already available in the link shown in the screen. So we can send this to the respective organizations for your easy access. So also, we can also be proactive in tapping our local chapters to reach our local governments and conduct or participate in events such as town halls or become resource speakers to educate more communities. We can also help generate demand and support from all healthcare workers down to the local level through activities that promote vaccination. So also, as mentioned earlier in the PCP, they will be having webinars. The DOH also will conduct a series of webinars. So on September 15 via Zoom, and all our local chapters may tune in for the most updated policies and guidelines. And finally, we can also try to incentivize going to site by offering possibly free consultations in VAX areas for both primary and specialty care. So to end, once again, our deepest gratitude for all of your efforts to support the national vaccination program of the department against COVID-19. So ang lahat po ng ating mga efforts at magiging suporta sa mga susunod na linggo at buwan ay mas makapagbibigay po ng karagdagang proteksyon para sa ating mga komunidad. So muli, maraming salamat po sa inyong lahat at magandang araw po. Thank you.
Thank you, Dr. Imran. And we will now proceed with our local question and answers, right here and right now with our dear speakers, Dr. Ana Ong Lim, Dr. Jean Solante, and the two will actually be joined in by Dr. Diana Payawal, the PCP president. And while waiting for the setting up of the table and the chairs, let me just again remind everyone for the benefit also of those who are here with us right now. Madalas ang lagi nating naririnig, hindi naman daw nakaka-prevent ng infection, nahahawa pa rin ang mga tao from COVID-19. If that is in spite of the COVID-19 vaccination that they got, I just want to emphasize that the key outcome of our vaccination campaign is really not just prevention of reinfection. It is the prevention of serious illness so that we can also prevent death of Filipinos. So with that, the floor is now open for any questions that our media friends here would like to ask. Yes?
Yes, good afternoon po. Good afternoon po, Red Mendoza po of the Manila Times. Kanina po nasabi nga po kanina, while preliminary pa nga lang po yung data regarding the fourth dose, sinabi nga po niyo, Doc Ana, na medyo encouraging yung data about the fourth dose. And yun nga, yung the experts had said nga na medyo na there is increased protection with the fourth dose. So with that being said, do you think po ba pwede na po ba ang fourth dose sa general population? Kasi right now, ang fourth dose is for 18 to 49 na immunocompromised and with comorbidities and 50 above. So do you think po ba itong data na ito would be a strong point to convince the government na pwede na ba nating ibigay ang fourth dose sa general population?
Sige, ako muna, tapos maybe I'll pass it on to the rest of the panel for their inputs. So going to the database na tinignan natin kanina, this is from the IVAC data, medyo limited talaga yung information. And you can understand that the way those studies were designed was actually utilizing at-risk populations. So para sabihin natin, and therefore we can conclude na the rest of the population will benefit, hindi manggagaling yun sa data set na yun. Mahirap mag-conclude coming from that database. Siguro yung additional information na shinare ni Dr. Suwat coming from their Thailand study, kung marireplicate yon or masusupport siya ng other studies, that can be a basis for saying na katulad nung third dose which we are encouraging for everybody from 12 and up, eventually darating tayo sa fourth dose. Siguro personally, yung perspective ko nito, I think the fact na medyo huli tayo nagsimula magbakuna, we can turn that to our advantage Nakikita natin yung developments in other countries, nakikita natin na may pakinabang ang fourth dose for certain populations, pero nandito na ngayon yung bivalent vaccines na ginagamit na sa ibang bansa. So who knows that maybe when the time comes na talagang karamihan sa ating mga population ay nag-wane na ng gusto yung immunity, ay mas maging widely available na yung bivalent at baka yun na ang pwede nating isunod as fourth dose. No? So ako, I'm hoping that sumakto na naman yung timing natin para mapakinabangan natin yung advancement na yon.
So, any rejoinder to Anna? Jeet?
I totally agree with them. So, translating it to which population will really benefit it, then pwede tayo mag-focus pa rin sa vulnerable population. And again, emphasize the importance of a first booster among the general population instead of focusing on the second booster for this general population.
Okay, so are there any other questions? Ayan, tinuturo ka na, Diana.
Okay, thank you. I think the data is quite impressive for sa sinabi ng ating dalawang eksperto sa infectious dito. So I think we should focus on the A2, 2.4% lang ang nabakunahan sa A2. And the rest, of course, will follow if you are able to achieve a higher vaccination for the A2 population. So we have to take cost effectiveness as an issue also here. So I think the vulnerable population is where the focus of booster is.
Thank you. So I can see one raising his hand, the one in blue.
Hello, sorry. Hi, I'm Boston from Rappler. Okay, natanong na kasi yung question kanina about the fourth dose. Pero like what you said, na parang as of now, wala pa sa equation yung giving the second dose. And we should focus on ramping up the first booster coverage for the general population. Pero there are people talaga kasi na ayaw pa rin magpabakuna. And ano kaya yung ways natin or what do you recommend for the government, specifically for the Department of Health, to boost our booster uptake for the first dose?
Yeah, okay, Diana.
Yes, thank you for that question. I think as the Philippine College of Physicians president, we are already advocating a lot of programs geared towards this. And I think this is the nidus now that we have, the spark of the program, with this webinar. So I think information dissemination, nung safety ng bakuna, I think most of the people are hesitant because of the adverse effects. Now, you have shown, and I mean the previous speakers have shown, the adverse effects are not as much now. So of course, we will not contend with the fact that there are adverse effects. So I think the bottom line here is information dissemination and a close monitoring of our patients who underwent vaccination. So I think most of us physicians do that. I think we opened our lines for patients who are vaccinated, or for our own private patients who are undergoing vaccination and who have this fear. So I think this is one way we can help as a private organization. For the government, I think they have done a lot. I mean, you can see we are all out right now, and there is a move to be a little lax on face masks. So I think this is something that we have to commend the Department of Health for doing this project.
Boss, can I just add to the question, the answer, Dr. Payawan? I agree, no, na information is critical for people to understand that it's important to be boosted. Siguro ang idadagdag ko doon is we need to build value for the boosters. Kasi kung babalikan natin yung panahon na bago pa lang ang dating ng bakuna, di ba nga halos pumila ka ng magdamagan, talagang sasadyain mo. Kasi alam mo na maililigtas yung buhay mo pag nagpabakuna ka. Pero unfortunately for boosters, there doesn't seem to be that same value. So hindi lang yung information, kung hindi yung pagpapahalaga dun sa bakuna pagtanggap ng boosters. Kasi I think that pagka nandoon na tayo, that we give it enough importance, then you will find a way to be vaccinated, to receive that booster. So bakit may disconnect? Bakit hindi dumudugtong yung information to action? Baka hindi lang information yung kailangan natin, no? Certainly maraming advocacies, yung nababanggit kanina with respect to getting the medical professionals involved, I think is a way of building value. Parang ipapakita mo na importante yan sa medical professionals, kaya nga sila nag-aaksaya ng oras na pumunta doon at kumausap ng mga taong magpabakuna. So I think that's the missing link. Do people value the booster? Do they understand what that can do for them?
Okay, if you don't mind, no, kung pwedeng sagot, makidhalo ako sa usapan na ito. Alam nyo, everybody knows me very well. No? I speak my mind out. I'm going to speak on an personal capacity, not as a Philippine College of Physicians person, okay? So I think ang key in any campaign will be effective communication. So probably I'd like to bring out the issue of the effectiveness of the campaign. The Pinas Lakas campaign, they have started, the government has started this few months back, and they were not able to get the desired outcome from this campaign. So I think it is high time to go back and try to find out bakit ba hindi effective. Hindi ko na-achieve ang aking objective dito sa kampanya nito. And therefore, if you are not seeing the objective that you want to get from the campaign, then you have to revise the campaign. So it is not ringing a bell among the Filipinos. So change the campaign and change it to why Filipinos have to get booster doses. Yun kasi ang pinaka-importante. And try to debunk lahat ng mga arguments ng mga anti-vaxxers, because that's the only way we can make the Filipinos lined up and get themselves boosted. Okay, I'm sorry. I'm passionate because, we're not getting the results that we want to see. So I hope, sana nandito pa si Imran, Nasaan ba si Imran? All right. So next, I think meron pang yes.
Dun lang sa communication, naman communication is really the key. Pero there have been reports kasi, especially abroad, na parang yung booster, it's a double-edged word. Na parang it connotes something na hindi naman yan necessary kasi nga booster lang, pang-boost. And we know naman yung Filipino culture na if it's not necessary, then they're not going to go for it. Right? So, meron po ba tayo, napapag-isipan na ba natin or any recommendation on how are we going to repackage this booster vaccination program?
With regards to the double-edged sword, I don't think that's correct, no? And we have here Dr. Mario Hayes, immunologist. I would like to get the opinion of Mario here. Mario, you're here. Kindly explain to the press regarding the effect of boosting to our immune system. Mario Hayes is part of the vaccine expert panel and immunologist and also affiliated with RITM.
Yes, good morning, Doc Gina. Hinahatsik mo ako. Anyways, so when you give a booster shot, it somehow wakes up your sleeping immune cells. Kasi if our immune cells are not active, they're not going to be able to produce the antibodies and produce the T cells that's going to kill the virus when we get infected. So when they're just sleeping in that state of, hibernation, it's not going to be effective in killing the virus when you get exposed. So the booster is actually a wake-up call. Basically, because you already have them in your system. The primary series, the main purpose of the primary series is to establish the memory. The major tenet of our vaccination is a memory response. So that anytime na meron ka in the future, madali na siyang gumising. Pero for some reason, COVID is a very strong type of virus na unlike the other viruses we know like measles or chickenpox na it can take time for them to grow and to multiply in the body. Si COVID kasi medyo mabilis eh. So, unless talaga yung ating immune system ay alive, alert, awake, enthusiastic, hindi natin siya magagampanan. So, that's why the booster is really a wake-up call for our sleeping memory cells, as well as to activate them so that anytime, any moment that you get exposed, especially ngayon, medyo lumulubag tayo, marami ng tao sa mall, marami ng tao sa sinihan and all that, na anytime na ma-expose tayo, hindi na natin kailangan na na antayin pa na dumami masyado yung ating immune cells, na na natin siya, nagising na natin siya. Okay ba yun, Doc Jean?
Thank you, Mario.
Thank you, Mario. So, okay na ba yun? So, anyone else who wants to ask? Yes.
Hi, ma'am. Good morning. Rafael Bozano po from ABS-CBN. I actually have the same question as Bonds, but I'd also like to follow up since we have the Pinas Lakas campaign and now we're doing another special vaccination week, and I think Dr. Imran has laid out the plans for this special vaccination week. Ano pa po ba yung nakikita ninyong kulang dito? Kasi he talked about involving the LGUs, the medical societies, but wasn't this also done in previous special vaccination days? So ano pa po yung pwedeng maging iba, and how can we do better in terms of encouraging people to get boosted this time around?
Ana?
Maybe, I think it's a very good question, no? Kasi kita naman natin kung ano na yung ginagawa, and the components are, maybe you would say, similar to what's already online. I think yung advantage of dedicating vaccination days is really drawing attention to the target vaccine. Hindi yan naiiba dun sa mga tinatawag na supplemental immunization activities or SIAs na ginagawa natin kaparte ng ating National Immunization Program para sa mga bata. Di ba kasama naman talaga sa regular vaccination, for example, ang measles or polio, and yet nagka-conduct pa rin tayo ng mga SIA or mga supplemental immunization activities para lahat ng resources na pwede pa nating matap, lahat ng focus mailipat natin dun sa target na dumami pa yung nababakunahan ng measles or polio. So parang ganun yung approach that is being taken with COVID vaccination. Ginawa din natin to nung simula, if you will recall, di ba? Nung nagsimula tayo with the primary vaccination, that was actually quite effective. So we're hoping that by doing this with boosters, we will be able to get a large increase in the target that we want to cover.
I think the strategy that we are doing for this framework is the bandwagon strategy. In other words, you join everybody else. And what the DOH did was put a network within, sabay-sabay nating gawin, a blitz type. So you get off more attention, as what Anna was saying. But I guess also in the bottom line, as she has alluded to the National Immunization Program, we need to have more teeth in this aspect. So I guess one of the things that we can do, aside from this blitz program or the bandwagon strategy of the DOH, is actually to require it in some aspects, like in workplace, maybe for children. So these are things that we can label off. Kasi like kami, as a hepatologist, we do require vaccination at birth for hepatitis B, no? So why can we not do that in this scenario? So I think putting more teeth is what the DOH can actually expand more.
Okay, thank you, Dr. Payawal. So you have one more, then to be followed by the lady in white. Bayan, sige.
Moving to another pressing issue, ma'am, yung optional use of face mask na nirecommend ng IATF. What do you think about this, especially since we know that the experts have been firm naman in recommending that, you know, we continue to mask up even in outdoor spaces?
Okay. So I think most of us agree